welcome to another episode of the Aligned and Elevated podcast. I'm your host, Dr. Alison Feldt, and I have back on the second-time guest, Bella Perez, and we are gonna dive a little deeper into talking more about endometriosis. We got a lot of good feedback about the episode, about the endo episode, and so let's do another one. Run it back, but we're going to dive a little deeper into some research that you've dug up based on questions that people asked us through DMs and whatnot. So we're going to hit those. And then I just have to tell you a little story before we get started.
Please do.
Okay, so my mom ended up finding out that she had cancer in her uterus, and it was like super early found, and they ended up actually just being precancerous cells. And so got this diagnosis, was able to get in for the hysterectomy to take everything out, did the ovaries, fallopian tubes, uterus, cervix as well, just to like make sure that there wasn't anything left for cancer to be in. Really good indications, like only precancerous cells, nothing had spread to the lymph. They do these dye tests when they're in there to determine which lymph nodes drain the uterus, and then when they do that dye test, those are the lymph nodes they dissect, because those are what drain the uterus. So if the uterine cancer has spread, they would dissect those lymph nodes, make sure that those lymph nodes are cleared. So that was a really good sign. Awesome. So they just had to take those lymph nodes and the uterus and everything that I just mentioned. So they end up taking the uterus, and they're like really happy with how it looks. Of course, it's going to pathology and like going to be very well analyzed, even though they analyze it during the surgery as well. It's a pretty long surgery. It's like a 3-hour surgery while they're like exploring for cancer and things not like that. They end up finding endometriosis on her uterus.
Wow.
And my mom, and of course my mom and my brothers are like, what's endometriosis? And I'm like, well, endothelial-like tissue that can lay adhesions down. And so my mom never had what she thinks is symptoms, but now I'm like, Mom, these can all be symptoms. Constipation can be symptoms, pelvic pain can be symptoms, and painful menstruation. And my mom's like, my aunt was there, and she was like, well, when she got her period when she was like 12 and 13, like I just remember she was in bed for days. She would just miss school, and like, but like that was back then. Like there was no answer for that. So could that endometriosis have been there since she was 12, 13? My mom was like, no way. I'm like, yeah, it really could be. And like grateful that it wasn't all over. How skilled was the surgeon to like really see if, because that's not what they were looking for at all.
No,
it was just it was just an aftermath. So I was just fascinated by this.
Absolutely. And what we do find is that when we look at sometimes fetal tissue also has endometriosis in it, so we do know, at least in some cases, it can be prepubescent even. So there's some indication. There's a lot of different theories about why endometriosis exists and how it's caused, and we'll get into that a little bit later, but there is some evidence that some people are born with it.
Wow.
Absolutely.
That's incredible to know. And also, just so everybody has an awareness, in case you didn't listen to the first endo podcast, you should absolutely go and listen to that podcast that Bella and I did a few weeks back. You'll find it on our YouTube channel. You'll find it in our, like everywhere you get your podcasts. However, I do just want to note that Bella is self-researched. She is currently studying to become a physical therapist. She's going into her sophomore year at UCLA, and she is a student of endometriosis. And it has been, like, she just dives into all the research, and she knows how to read research with a really diligent eye, not to believe every single study. And so that's really what she's brought to my table. And, we're so fortunate to have her at the clinic this summer, and I've kind of just leaned on her to be an expert. And she truly is, she has made herself an expert in the field. And so I just absolutely love having you on, and, go back and listen to her story, because it is really inspiring how she really advocated for herself to find out that she had endometriosis, and really she explored for herself what the best solution would be for her own body.
Thank you.
Yes. Since we've talked, you've had pelvic floor physical therapy here, and so I'm excited about that.
Yes.
And of course that just is good for everyone, but especially when you have endo, just because they resect it doesn't mean that there's not residual scar tissue left over from those surgeries. So I'm glad you're getting that work done. I know I'm talking a lot here, and I'm going to give you the platform the rest of the time, I swear. you know, and how much is a HIPAA violation when someone just shares it on the street? I was sitting in the waiting room yesterday waiting for my mom to get out of surgery, and there's another guy there, and his wife was in surgery because of endometriosis, getting a hysterectomy at 29, and you know, you just, your heart goes out to that, and like they're at their wits' end, right? Like he's like, this, like, we're actually like really excited. They already had they had one child, so obviously this takes away any opportunity to have another. And he told me that they were leaving a part of her ovary so she could at least have her hormones, because again, only 29, not perimenopausal, not menopausal, needs those hormones. And he was like, we're just hoping that this is the answer to all the pain, you know?
Yeah.
And I was just like, yeah, I hope so too. And I was like, does she have a pelvic floor PT?
Yeah.
And he's like, yes, she does. And I was like, great. And like that, our conversation kind of ended there. I was like, I work with people with endo all the time. I'm a pelvic floor PT. But it kind of breaks my heart, you know, to hear a 29-year-old has to lose her uterus to do that. And obviously, like, they were blessed to have a child, and maybe that's all they wanted anyways.
Yeah, of course.
But it's just, it's hard. Like, this diagnosis is hard.
Yeah.
Having endometriosis is really challenging.
Absolutely.
So, I'm excited to dive further into the research. So why don't you,
I wanted to add on to that.
Please.
So a lot of times we do think of a hysterectomy as kind of just fixing any type of problem, but actually a hysterectomy does not cure endometriosis. So I do just want to put this out there that it's definitely something to be discussed with a doctor and all of that stuff, but ultimately with endo, it's on the outside surrounding organs a lot of the time. So it's not like a definitive cure. So I just wanted to like clarify for people that even though they're like super excited about that, and I'm sure they've talked with the doctor and that's the best decision for them, getting a hysterectomy doesn't actually cure this disease in a lot of cases, or any cases. But
yeah. Well, and that also goes to say, getting endometrial lesions removed isn't going to cure you from not having more endometrial lesions in the future. Yeah. So it's a management solution, not a cure.
Absolutely.
Across the board, any surgery, even for you, right?
Yes.
So, yeah, I think that's great. I'm glad you denoted that.
Yeah, I mean, people are so hoping to be out of pain, and oftentimes it can be marketed as a hysterectomy, but really the gold standard is excision surgery, and that is what is recommended. That's the best treatment that we have to offer people with endo in terms of surgeries, I guess.
Yeah. Can we add in there, even though this isn't research based, because I've been just reflecting so much, like this is what keeps me up at night kind of thing.
Yeah.
Because I've been thinking about like my mom's uterus and like this stuff. And so I also really believe that like gold standard of management of endometriosis has to be pelvic floor PT and regenerative medicine. I think the shockwave therapy that the protocols that we've created to help women have not painful periods, help them conceive, has just been huge. It's been huge for our clients with endometriosis and with undiagnosed endometriosis, you know. So I just think I really wish that like there's no research studies on that, you know, and how we use EMTT and shockwave as our regenerative tools. Even red light, you were like, red light's helping so much manage some of this cramping, and it's like these are our regenerative tools that I think go hand in hand, and nothing can do the work of actually stretching the muscles and stretching the fascia that pelvic floor physical therapy does when it's high quality internal work. And that can really help loosen up the adhesion, so you're not, which doesn't mean that they go away, it just simply means that there is more movement in the tissue, so there tends to be less pain because there's more blood flow and more movement in the tissue. But anyways, I digress.
Yeah, absolutely.
So I wish that was gold standard, so please make a
well,
research study and include us in it, or figure out how we can do that, because like, gosh, wouldn't that be cool if you were already a research like based scientist before you go to PT school?
Yeah. Absolutely.
Oh, figure it out. I'll get you data. Like, we'll just be your data.
Perfect.
Whatever you want to do.
Yeah.
Okay. This is gonna go on forever if I don't get to the point. So we got one DM in the Instagram, and it said like it was saying that C-sections can lead to endometriosis, and we want to make it. And that is like a common misconception.
Of course. Yeah.
And so we want to be super clear. So that kind of like dove us into finding all this research. So tell us what you found in relationship to like that. it wasn't necessarily a question, but more of a statement. So kind of like break it down.
What a lot of people are referencing when they talk about C-sections causing endometriosis is actually this study in Sweden that was done between the 70s and I think 2004.
Okay.
And so what this did was it tracked all the births in Sweden, and it said, is this a vaginal birth or a C-section delivery? And then they followed those women throughout these years, about 10 years on average, and they looked and said, what is the lifetime risk that women who get C-sections have endometriosis diagnosis later versus vaginal delivery? And what they found was actually that women who have C-sections are more likely to later be diagnosed with endo. And there's a couple of reasons that we can attribute that to, other than C-sections actually causing endo. So the first reason that we can kind of look at is that women are actually 1.86 times more likely to have a C-section if they have endometriosis. So this is a huge, this is actually a really huge problem. There's more likely to have pregnancy complications in people with endo, and when we look at the population who are getting C-sections, maybe they already have endo, and that's leading to this higher percentage who are later diagnosed. So there could be people who aren't diagnosed and have endo and then have a C-section and are later diagnosed. So that's one possibility. A lot of times in researching, we make sure that we remember that correlation doesn't mean causation. So it is true that this one study in Sweden like 20 years ago did show people with C-sections were more likely to later receive a diagnosis, but that doesn't mean that C-sections cause the disease itself. And furthermore, what we can look at is a lot of times when people have abdominal surgery with endometriosis, there is a possibility that, especially if it's not an excision surgery, there is a possibility of creating more scar tissue most of the time. In about 90% of cases, there's more scar adhesions and that type of stuff. And so it can make it more apparent for a later surgeon to see like more spread endometriosis. And then what I do want to touch on though is there is this phenomenon where C-sections can cause, this is a little bit of limited research, but there is some research that C-sections can cause a spread of endometriosis. So what I'm referring to is abdominal wall endometriosis and also C-section scar endometriosis. So we do see, and I think it was 0.1% of times after a C-section, not including people who are already diagnosed with endometriosis, but 0.1% of the time there is endometriosis now growing in the C-section scar tissue. And obviously, that would not be happening with a vaginal delivery, so that can lead to people having this misconception, but ultimately,
Yeah. And so what I think, just to like get it a little more layperson words,
yes,
is that just because you have a C-section, it doesn't mean you're being predisposed to endometriosis.
No.
If you have endometriosis, it might become exacerbated, or symptoms can show up after the C-section, but the C-section itself isn't going to cause endometriosis, is what I'm hearing.
We don't have data that it does or doesn't, but we most certainly don't have data that says it causes. Again, it's not researched entirely that the opposite is true either, but just,
so
there's not evidence that it causes it.
Okay, can I give you my, doctor perspective from a clinical standpoint, not the research laboratory, is that when you have a C-section, that scar tissue becomes adhered. And so what I think could be happening as well, so C-section scars can really wreak havoc on the body, and it can cause sciatica, low back pain, a lot of other things. So what I also think can be happening, it can cause pelvic pain, painful intercourse, difficulty with urination, whether it's urgency, incontinence. The list goes on and on and on. Abdominal scar tissue is massive in females and probably in males, but I'm not in that world. I'm in the female world. And that's who we see and obviously treat in the clinic. So when people have abdominal scar tissue, it can wreak havoc. It can cause even just like underlying hip pain for years and years and years. So all of this I say to note that if you're having abdominal pain or pelvic pain or severe menstrual cramping, all of which can be caused by C-sections. If you go in and do an endoscopy or a laparoscopic surgery after that C-section, it could be that the symptoms were caused by the C-section scar, but then they incidentally find endometriosis. And so maybe you blame the symptoms on the endometriosis. But really, truly, any scar tissue, whether it's endo scar tissue and adhesions or C-section scar tissue and adhesions, can cause that discomfort. So I think that cause a ton of symptoms, but I think that you're probably more likely to actually find the endo because people with C-sections actually end up having more symptoms because of that C-section scar. Does that make sense? Yeah. That's what I think from a clinical standpoint. So we might just be finding it more in the women that have C-sections, but it might not necessarily mean that the women with C-sections have more likelihood of endo.
Yeah.
So,
absolutely. And there is silent endometriosis as well. It's a little bit of a kind of controversial topic because is silent endometriosis silent or are women ignored? So with your mom, what she was kind of describing sounds a little bit like what doctors might refer to as silent endometriosis, where you have this person come in and surprise, there's this incidental finding of endometriosis. And she's like, there's no way, like I don't have any symptoms. But when we look back, being bedridden for weeks on end is absolutely not silent. That is a huge quality of life issue. And that's just a really unacceptable symptom, I would say. So there are absolutely people who do not have any symptoms at all. It's kind of hard to narrow down the percentage of those people out of the total people who have a diagnosis. But it's just a very kind of hot button topic. Yeah, absolutely.
I just have to throw in there, this is not about endometriosis, but kind of is. If you have painful periods, that's not normal.
No.
If you have severe heavy bleeding, that's not normal. If you're bleeding through pads and tampons, get it checked out.
Of course.
Talk to your healthcare provider. Go to pelvic floor PT. Get an exam by a pelvic floor PT and an OBGYN. And if you don't get answers, go to another one and go to another one and go to another one. Just don't stop, because it is not okay that if you spend more than 100 days of your year debilitated by your cramping in your menstrual cycle, that's messed up, right? And so there are a ton of solutions. Like we help people with painful periods every day, all day. And also you could have underlying endometriosis as well. And when you have this type of pelvic pain or severe debilitation because of periods, you want answers. Like it's not fun to go from doctor to doctor, or even just be laying in your bed being like, what the hell is wrong with me? How come I can't stretch this out, ice this out, massage this out, right? So anyways,
I really like what you said about going to both an OBGYN and a pelvic floor therapist, and I think it's really great to combine those two options. For me, that's been the most effective in getting help, I would say.
Is there a genetic component to endo? Tell me about that. And hold this just in case.
Yeah, so let's see, I don't know the exact statistic, but there is absolutely a genetic component where if your mother or grandmother has endometriosis, you're much more likely to also have endo yourself. So kind of the issue with discovering this genetic component is because our mothers, our grandmothers did not get the health care. I mean, we barely get the health care we deserve, but our grandmothers and mothers really did not get any help with this. So even within the percentage of people that we estimate have endo, there's huge ranges between 1 in 9, 1 in 11. So there is definitely a genetic component, but it's kind of hard to pin down exactly how strong that is, because the fact is people were not getting diagnosed, and people still aren't really getting diagnosed, but especially back then.
I appreciate you diving into that. I don't mean to throw you questions without you having prepared the data, but I think that's good to know. So is there an exact gene that they've identified that carries a predisposition for this?
Let's see. I'm not really sure. Okay. I don't know of one. I don't know of one. I'm not sure.
All good.
There's not like BRCA to breast cancer. I can say that there's not like a very specific
one where you can be like, this is the problem gene. I can say that. I think there have been some genes that have been identified, but it's not as strong as like the BRCA2 gene with breast cancer and stuff like that.
But if they're finding it in fetal tissue, that means that there's more than just an environmental probably component. I mean, there could be an environmental component, I guess, from like the pregnancy, the embryo, like that situation. There's definitely an environmental component to endometriosis. We have a ton of estrogens in our world, right? And you can't really, no matter how clean your lifestyle is, you can't really protect yourself from all that, right? And so is that a misconception? Am I spreading bad news?
No. So what we do know is that it can be in people who are prepubescent. It can be in fetuses. So we do know that there is definitely a possibility of endometrial type tissue being in someone's body without having like their cycle. So what we also know is that we have epigenetics. So we have certain genes that can be turned on and off. And so there is a lot of theories about what causes endometriosis, and one of these theories is that certain genes are activated by environmental factors that cause endometriosis. So there's absolutely evidence towards a lot of different theories, and people really don't know what causes this. But what we do know is some people have this type of
lesions at birth, like this tissue displaced at birth, and we also know that environmental factors can worsen it. So people with who smoke or have higher BMI are more likely to be diagnosed. Who knows, again, as we touched on with the C-section rate, who knows really what that all means? But there's absolutely a case for environmental factors as well.
Thank you so much for sharing that. So let's dive in. You looked at a lot of other data and studies. Do you want to share? I would love to know just like what stood out to you. What do you feel like the people need to know? Will you share some of that? I don't have a specific question. I would love to know a little bit about more what you looked into. Bella's scholarly interest and really investment in endometriosis, I feel like, is benefiting all our patients because she's educating all our doctors. She's now, been on the podcast. This will be her second time. So I just truly am grateful for the knowledge that you're spreading and the advocacy work that you're doing. So take it over.
Awesome. I think the main thing to keep in mind with endo is that really it's just not your fault. Like, you can have these symptoms, you can do everything right, you can be doing pelvic floor PT, you can be getting surgery, you can be taking the hormones, you can be doing all of these things, and the fact is we don't have a cure, which sounds very discouraging, and it is, but you can be changing your diet, all of these things can help, but if you are still in pain after doing all of that stuff, like, it is just a really painful disease. And this isn't to spread hope that it can't get better, because I do believe that there are options, and I do believe that science will hopefully advance in a way where maybe we will have a cure, or maybe we'll have better treatment options. But if you're feeling really discouraged and you feel like you're doing all of the things right and you're still having pain, like, it is just a really tricky disease to deal with. And like, I feel like I'm doing everything right personally. Well, I mean, like, not really.
Everything you know, though. Everything you know.
I still drink my coffees, which you're not really supposed to do. But I feel like I'm doing a very reasonable amount of right things. And I still have symptoms. And I got surgery, and I got hormones, and I got pelvic PT. I did the most I can, and it's helped a lot. But I'm not back to symptom-free, I would say. And that's really, like, not something I feel the need to be, like, mad about, myself for. Especially, it was really comforting to me to find out that people before puberty had endo. So it wasn't, like, something I caused. Like, it's really no one's fault. It's just a weird thing that happens, and we just don't have enough support or research around it. But,
That's so beautiful. Endometriosis is not your fault, and I love that. I absolutely love that, and I think, and that's what I've spoken to many times in this episode and on the previous. It's like the determination, though, to work to get yourself out of pain from a higher level. I believe we're all put on this earth, and we're given our journeys. No one has an easy life. Everybody has traumas, whether they're macro traumas, massive terrible things that you can't even want to fathom, to like little traumas that happen on the playground, right? They all affect us. They're all traumas, and we work on healing and developing and evolving to become the people that we want to be, that can hopefully contribute some kind of good to the world. And we're all delivered different journeys, and we, I believe, have to make the best of it. And we have to play and enjoy in order to learn and grow and you know, have as much of a positive mindset as I think we can. And so I hope this doesn't come off as like some privileged bitch that doesn't have endo sitting there saying this, but I do believe that like when you have to fight through, like you said, this started kind of for you in your teenage years, like when you started menstruating, right? Is that when the cramping?
I was like 11.
Yeah, I was 11 too when I got mine.
Yeah.
And what I think is just so important, like if you can take the mindset to say, like, when you can start to see these lessons, that whatever disease you end up getting, whatever disease your partner has, whatever disease or trauma or bad thing you end up having to go through, these are things that when you do go through them, they make you stronger. They make you more resilient, right? And I would never wish this upon anyone, of course, but I do think like there's just some grit that you get when you have to fight for yourself like that. Like, you learned how to use your voice at a really young age.
Yeah.
I'm still learning how to use my voice, and I have a podcast. No, I'm not kidding. Like, it's real, you know? And I think many women are in that category of having to use their voice. And so it's almost like maybe that was your gift that you got, you know? And when we can start to almost have gratitude, I guess, for the shit, right, in our lives, I'll say, since I spoke on my mom in the beginning of the podcast, we both laughed because when we found out she had cancer 2 weeks ago, we were like, well, thank God that you had sciatica. So she had this like terrible bout of sciatica. She was coming to the clinic, and she was finally, what wiped it out completely was the MTT. And she was like, and my mom's super cheap, like, and she's like, I can't even believe I kept the MRI. Like, I'm pain free. Like, I don't need my back MRI. Well, incidentally, they find the uterine cancer.
Wow.
And so it's like, my mom's like, I can't believe I'm saying this, but I'm really grateful I had sciatica and was debilitated for 6 months.
Yeah.
You know, and you're like, yeah, like, there's, like, life is funny.
Yeah.
But it's like when you can start to see, like, yeah, like, I actually am grateful for all that pain I went through. And also, like, there was other lessons that came of that. Like, you know, let's keep our bodies as tip-top as we can. She was grumpy. She hated, like, she was not her best self, and she didn't love that about herself. And then when I've now been seeing myself go through this back pain, I'm like, I'm the same. I can be just a complete and utter bitch. And it's like, and I have no energy when I have pain, and like, you're just like, it gives me another level of compassion and empathy for, you know, for women that go through this and still have to raise their family and show up to work. So what I'm saying, and I'm not trying to be an asshole about it, is like when you have endometriosis or some kind of disease, it's like, what lessons can we take here? And obviously you're taking the lessons, you're letting your pain, you're advocating in these massive, amazing ways, and maybe that's like your mitzvah, that's what like people in Judaism call like your purpose, okay? And so I'm not Jewish, but like I listen to a lot of different religious authors, and so I get to learn what they say, and so that's just, it's like, that's your purpose, you know? And maybe, who knows, but like those are your contributions. Like endometriosis sucks, and you got to now use this to advocate and change the world for many, many women that are also going through this experience, right?
Absolutely.
So I don't know, that's where I'm at. That's what I think it's totally not your fault, and how can we use this to get you to the best possible place possible to manage this right now until there's a forever cure, and also how can it benefit your life positively, I guess.
Absolutely. That's very beautiful. Absolutely. Absolutely. I think that it's a super challenging thing, and it doesn't have to be a net positive, but it can be a little positive in some ways. And I think a lot of things can be like that, where it's still not really worth going through, but there are things that I can take from it, I guess.
Yeah. Well, thank you. Thank you for sharing your story. That's a wrap. We hope you gained some insight. And if you're listening to this and you have endometriosis, or you suspect you have endometriosis, I think Bella let us know it is not your fault. That was the most beautiful phrase ever. I just love that. So thank you for saying that. And we want you to live your best life and get as symptom free as possible, because what this is all about is helping you unlock your potential so you can contribute your gifts to the world. And you can't do that when you're suffering in silence. So we want to get you as comfy as possible and get you in the right hands. So hopefully this gave you some insight or clarity into what you're experiencing or what your friends might be experiencing. So like and share and send this out to the world. Thanks for joining me. I'm Dr. Alison Feldt, Bella Perez. Until next time.
Thank you.